Let's say you're one of the 35,000 people who will overdose on opioids this year. From the moment your lungs stop working, you have 4 minutes before permanent brain damage. On average, it'll take 8 minutes for a first responder to even get to you, meaning there's no time left for them to inject you with Narcan, the only solution for opioid overdoses on the market. But new tech might have a way of helping addicts from getting to that point in the first place. It doesn't matter how skilled a first responder is or how effective their medications are. If they can't reach a victim of an overdose fast enough, they can't save them. The future AI can be a critical tool in finding victims before they OD, if it's given the chance it deserves. The Massachusetts Department of Public Health, the CDC, and HHS have all spearheaded the use of analytics and algorithms to find hotspots where ODs are likely to happen. With artificial intelligence, emergency services will have a better idea of what areas are most in need when it comes to opioid overdoses. With more data, they can get to more people faster, literally giving first responders the eyes they couldn't have otherwise. And to support that initiative, the federal government has offered up $28.6 million. But that is going to be distributed over 44 states, which is most of the country. Now, that's a step in the right direction, but it isn't enough to make a dent. And in circumstances where a few seconds can make the difference between life and death, it's puzzling that we're not investing real money into the macro systems that can make a difference. And we need to make a difference. 80% of heroin users in the United States first misused opioids that were prescribed to them by doctors. Not included in that statistic are all the family members and neighbors who steal opioids from the real patient. Because when a doctor prescribes opioids to one person, there's a whole ecosystem of people who are susceptible to getting addicted. But new tech like timer caps can give the real patient more control over their drug supply. The actual cap on the pill bottle measures the time since the bottle was last opened, which lets you know if your medication has been stolen. Although this doesn't stop somebody from stealing your drugs, it does make it harder for the theft to happen in the first place. It lets you know that a larger problem is brewing under the surface, and awareness of a problem is the first step to fixing it. None of these technologies or policies are perfect today, and none of them can tackle the overwhelming complexity of the opioid crisis individually. But with the right attention, research, and money, a combination of future tech can develop targeted solutions to slowly chip away at a national pandemic.